I'm Dr. Richard Lyon, and in this video I'm going to demonstrate how to use the latest generation of the SOF tactical tourniquet wide, often called the SOFTT or SOFTT-W. This device is designed to be used on patients with severe bleeding of an extremity, resulting in effective management of the bleed until a patient can receive definitive care. First, remove the device from its packaging. Take off the elastic bands and unwrap the device. Slide or clip the tourniquet around the limb above the bleeding site and pull tightly. Twist the windlass as many times as possible or until the main flow of bleeding is significantly reduced or stops. Be aware that the patient may find this painful. Slip the end of the windlass into the plastic triangle to lock into place. Make sure to note the time of application and write it into the space provided on the tourniquet. Always consult the full instructions for use for warnings and precautions before using this device.